The Manchurian Plague, also known as the pneumonic plague of Manchuria, was a deadly outbreak that occurred between 1910 and 1911 in northeastern China. Unlike the more common bubonic plague, which is transmitted through flea bites, the Manchurian plague was pneumonic, meaning it spread directly from person to person through respiratory droplets. This characteristic made it extremely contagious and more lethal. The outbreak, which killed an estimated 60,000 people, became one of the most significant health crises of the early 20th century. The origin of the Manchurian plague is believed to have been linked to a booming trade in marmot fur. Local hunters, often impoverished and desperate for income, hunted marmots in the vast forests of Manchuria, which bordered Siberia. However, marmots in the region were known to carry the Yersinia pestis bacterium, the pathogen responsible for the plague. As traders sold infected furs, the disease began spreading to people who came in contact with these animals or their carcasses. Hunters, traders, and ultimately, entire communities were exposed to the infection as it moved quickly through Manchuria's cold, crowded towns and cities. The rapid spread of the plague caught the Chinese government off guard. With limited medical resources and expertise in handling an epidemic of this scale, officials called upon Dr. Wu Liante, a prominent Chinese-Malaysian physician educated at Cambridge University. Dr. Wu quickly recognized that the disease was spreading through the air, a significant insight given the common belief at the time that plague transmission was primarily through rats and fleas. He implemented strict quarantine measures and isolation wards, and promoted the use of face masks, a groundbreaking move for public health at the time. His specially designed mask, made of gauze and cotton, became a crucial tool in limiting the spread and is seen as a precursor to the modern surgical mask. Dr. Wu's leadership marked one of the earliest examples of scientific epidemiology in East Asia. He organized a large-scale public health response, including medical education, quarantine regulations, and restrictions on movement. Officials ordered homes and public spaces to be disinfected, imposed travel bans, and conducted mass cremations to prevent further spread. However, such measures were not without resistance. Cultural customs and political tensions made it difficult to enforce some policies, leading to further conflicts and challenges in managing the epidemic. The Manchurian plague eventually came under control by early 1911, largely due to the persistence of health workers and government intervention. Dr. Wu's work was internationally recognized, and he was invited to present his findings at the International Plague Conference in 1911, where he gained widespread acclaim for his groundbreaking public health measures. His efforts helped establish modern epidemic response strategies and inspired future public health practices in China and beyond. The impact of the Manchurian plague went beyond immediate loss of life. It highlighted the need for stronger public health systems, international cooperation, and preparedness in combating infectious diseases. Dr. Wu's pioneering use of face masks and quarantine principles foreshadowed the practices used in later pandemics. In a broader sense, the epidemic was a turning point in Chinese medical history, pushing the nation to modernize its healthcare infrastructure and adopt scientific approaches to disease control. The Manchurian plague remains a historical reminder of the devastating potential of airborne diseases and the importance of swift, scientifically informed public health responses.